So hi everyone, my name is Toni Mills. I am a patient advocate with Texas Coalition for Compassionate Care. We're an organization of many men and women, patients, nurses, doctors from all organizations. I come with some unique experience. I worked in Washington State over 28 years in the healthcare field. The last few years I worked with medical cannabis patients. So I'm going to go into a little bit about the difference between medical cannabis and recreational cannabis and what we discuss with our patients. This is one of the graphs that we use, I use with our patients to show them the difference. There's no place to set any paperwork here. To show them the difference of the CBDs and the values of medical cannabis. And if you look on that graph, you can see where, people with anorexia and bone pain can look on that graph and see the different chemicals in the cannabis plant that benefit them. Forms of medical cannabis. There's several types. Most patients don't smoke medical cannabis. A lot of people seem to think that our cannabis patients are smoking joints. We don't have our pediatric patients smoking cannabis. There's all sorts of different types of cannabis. There's topical balms. A lot of my geriatric patients love those. They use them on their hands. And that, there's bath salts. Of course, there's the flower. You can see on there where they have the test studies next to the flowers, so patients can use those to make better determination on their medication choices. Of course, there's the tinctures and the oils. The oils and the tinctures are widely used with our pediatric patients. Medibles, that's a wonderful choice also for patients. And then there's several different types of drinkables. You can get soda pops, all sorts of teas. The importance of testing medical cannabis. This is one of the big differences that I find with medical cannabis and recreation. Medical cannabis patients don't use medical cannabis to get high. They use it to relieve many symptoms. When it gets sent to the lab and tested, it shows those patients that it's free of molds, mildews, pesticides. And it's safe. It also gives them their wonderful test study that comes along with the patient, with the medications, depending on whether it's dry herbs or medibles and they eat. And so what happens is with this test study, you can see the different CBCs, CBGs, it shows the levels. So patients that have severe anxiety would look at that test study and possibly choose a lower THC medication so it wouldn't trigger their anxiety attacks. It's one of the forms that I think is really beneficial for patients. With medical cannabis, the one thing I like about it is that it is the only medication that a patient is in 100% control over. They can use it in many different types of forms. They can use as little or as much as they want. And never are they ever at risk of overdosing and dying, ever. I cannot say, as Stephen said, I can't say that about the synthetic medications that we have prescribed to patients. And I do know those patients that I've lost. I know their children, and I know their husbands, I know their wives, their mothers, and their fathers. With medical cannabis, I don't get those phone calls that patients have overdosed or went to bed and did not wake up because of the toxic buildup from the chemicals from the synthetic medications. This is one of the safest medications there are. So what you can do, I'm sorry, this thing isn't forwarding for me. How you get involved. Next. Okay, somebody know how to get this working? It's frozen. So it won't come off and it won't forward.
You just have to click on the first mouse button and use click to go through your slides.
Okay, here we go. So patients, we got it, thank you. Patients, like I said, patients, I've worked with patients from pediatrics all the way up to geriatrics. They're your friends, your neighbors, and they're your family members. There's children. You know, it is up to us to help ease their suffering. Medical cannabis has been effective in many, many different types of diseases. It not only is beneficial with pediatrics, geriatrics has been shown to help with dementia, slow down the progression of Parkinson's. Our vets, for post-traumatic stress disorder, I worked with several vets in Washington State that we were able to get off on numerous synthetic medications, benzoprine, all sorts of stuff. And they thrive and are being able to become productive citizens again. And that's the whole point in helping these patients achieve and help them have safe access. What we can do to help them is get involved. We need to support medical cannabis bills. Our patients are sick. Some of them are hooked up to IVs 6-8 hours a day getting treatments. These patients are too sick to sit at city council meetings, town hall meetings, go to Austin to speak to our reps. That's where we need to step up and help protect these patients. Call your state representatives. Let them know that you support medical cannabis. If you have a mayor like I do in the city of Mesquite that is not cannabis friendly, has no concern or consideration for those patients, get a group of people together like I am going to do and go to a city council meeting, which we'll be doing on June 17th. And we will sit there in unison and say, I am not advocating for myself. These people are not invisible. These patients exist. And without you, these patients suffer. We need your help. Talk to your friends and family. It starts there. When you wear a shirt and somebody asks you about it, tell them about people suffering. I worked in the healthcare field and volunteered with cannabis patients. When I saw Cassie Hyde's story, it broke my heart. It's an atrocity that children are suffering. It's an atrocity that our patients are suffering when we know that this natural plant saves them and brings them a quality of life that those synthetic medications can't. So if you have any questions, we have a table over there. We're more than happy to answer any questions for you. Thank you for your time.